because we have to leave it at this. We are hoping to talk to Uba Ifeanyi in a few minutes, who is part of the candidates that ran for the election today. I want you to briefly talk to us about. I understand there is a research paper that you published in PLOS Journal. Tell us a little bit about that, the research you've been doing here, and is it something that we could use in Africa that will be of benefit to people in Africa?
Yes, so we recently published a paper in PLOS One, which is the flagship journal of the Public Library of Science. And the title of the paper is Lactose Intolerance, Lack of Evidence for Short Stature or Vitamin D Deficiency in Children. And basically what we wanted to do in this paper was to answer the age-old question about the complications of lactose intolerance, which is a condition where an individual is not able to digest the lactose, which is the basic component of milk, and break it down into glucose and galactose. And this is a strange disease, if I will call it a disease, not really a disease, but what happens is that before the advent of agriculture, human beings were programmed to lose the ability to digest milk after the time of breastfeeding. So in the first 4 or 5 years of life, you shouldn't be drinking milk, right? But then agriculture came into the picture. And so people were able to now produce milk. And because there was milk, people had to drink it throughout their lives. But only 30% of people are able to tolerate milk as adults. And these people, it happens, possess a mutation. So they possess this mutation that allows them to preserve the function of the enzyme lactase. So people who are able to tolerate milk as adults are actually carrying a mutation. The normal people are not able to handle milk as adults. So that's strange, isn't it?
Yeah. So what happens now? So we should stop taking medication, people like me who cannot take milk? Is that what it is?
No, you should just focus on lactose.
Lactose-free.
Okay. Yeah, lactose-free diet and all that. But anyway, the paper what we did in the paper was to now study 2 groups of children who are not in puberty, but one group has lactose intolerance, the other group does not have lactose intolerance. And we wanted to settle a central question, which is, do the children with lactose intolerance have lower vitamin D levels? Because if they do, that means they are not able to absorb the calcium they are taking in the diet. And that means that they may actually have problem with their bone mass, and so may be at risk for fractures, right? Now, other papers have also been published showing that these children with lactose intolerance are shorter than normal children. So we put these 2 questions to the paper, and we found that, 1, children with lactose intolerance do not have lower vitamin D levels compared to normal children. And that is easy to prove because we make vitamin D when we expose ourselves to sunshine. So, and if they have normal vitamin D as normal kids, then they should not have low calcium, fractose, and so on and so forth. So we settled that question in that paper. And then we also now looked at the height of these children, and then we projected what their final height will be using what's called a mid-parental target height. And then we expressed all our results in what's called the standard deviation score values. So we're able to show again that these kids are not shorter than the non-affected children. So we have settled this question, we believe, but I'm sure there will be other people who will be coming out with more publications in the future in this area.
Okay. Now, Dr. Nwosu, thank you so much. Let me say that some people have contacted us, and people contacted me and said, why is it that Anambra State produced this kind of the array of candidates we have? And when we have a lot of people who should have done better, do you think that down the road you might want to go to Anambra State and rescue the state somehow?
Well, it's not a question of rescuing the state, but I think, people have also raised those questions in the past, and we are looking at the questions, and we are not saying yes or no. We'll continue to look at the logistics.
All right. All right. Thank you so much.
Thank you.
That was Dr. Ben Nwosu, Associate Professor of Pediatrics at University of Massachusetts in Boston area. So when we come back, we are going to talk to the candidates. I know that we are trying to reach Ifeanyi Chris Ngige, and Willie Obiano, and all their supporters. And we're also going to talk to voters, people who actually went to the polls and voted for these candidates. So stay tuned.